everyone. My name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
My name is Jesse, and I'm glad to be along this journey with you as a co-host. Whether you're listening in your car, the treadmill, watching us on YouTube or Facebook, thanks for checking us out. If you find this podcast helpful or beneficial, please feel free to like and subscribe so you can be notified of future episodes. I will now turn it over to my co-host, Lisa, to introduce our guest today.
Thanks so much, Jesse. And thanks for prompting everybody to kind of join us for more sessions. And this is one of the reasons you might want to do that, because our guest today is a returning guest. So this is May and it's Mental Health Awareness Month. And so we figured we would take the opportunity to actually do a second podcast this month because we really want to focus on this important issue. And so what we have back today to work with us is Dr. Zlatina Kostova, who is a clinical psychologist. She's a director of training at Lifeline for Kids at UMass Medical School, Department of Psychiatry. And so she's been with us before doing a great detailed conversation about the impact of trauma on addiction. And today we're going to take a little bit of a different focus because one of her other areas of expertise is mindfulness based cognitive therapy. So we want to talk today about how can mindfulness be supportive both for mental health symptoms, which often are co-occurring with substance use disorder, and for addiction. So with that, welcome, Zlatina. Thanks so much for joining us again.
Thank you so much, Lisa. Thank you so much, Jesse. Welcome, everyone. I'm so happy to be here because this group is full of energy and enthusiasm, and I'm very happy to talk about mindfulness, which has been one of the things that have helped me a lot in my life in US. So I can talk a little bit about this as well.
Excellent.
Beautiful. So I guess just to start off, Zlatina, as we were talking before we went live here, if I had to ask you what your very straightforward definition of mindfulness would be, because it's kind of a term that people use sort of as an umbrella statement. And, it can be, I know for me personally, somewhat confusing, at least at first, when I was sort of learning about it. So if I asked you what mindfulness was as a basic definition, I'd be interested to hear yours.
That's such a great question because you're so right. Mindfulness is a sort of a new world. And me as a Bulgarian and person who lived in several countries, I know that there are many people who are still like, what is mindfulness? So there are a lot of definitions. The definition of John Kabat-Zinn is that mindfulness is paying attention with purpose, non-judgmentally, and with curiosity. And so for me, mindfulness is simply being aware of what is going on inside of you and outside of you. So are you aware of even now your body, the posture of your body? Are you aware of your breathing? Are you aware of the constant thoughts running around your mind? And at the same time, are you aware of the light coming out from the windows and the noises around you? And the other piece is having this awareness from a stance of curiosity and non-judgmentally, right? Because I think that this is the real magic of mindfulness, this idea of simply noticing things as they are. So that's kind of my way of understanding.
That's such a great definition. And I think it helps people recognize that, mindfulness does not have to be tied to religion. So one of the things that often we hear when we do mindfulness work, either in group settings, on our inpatient units or on our outpatient programs, is any resistance often can be tied to thinking that you have to have some kind of specific spirituality or religious direction in order to practice mindfulness. And that's simply not true, like, given the description that you just gave. And I also use John Kabat-Zinn's definition as well.
Yeah, absolutely. Thank you, Lisa, for pointing this out. It's interesting because I worked in inpatient psychiatric settings for kids and adolescents. And I did a lot of mindfulness groups with adults, but also with young adults. And what I was noticing, particularly with young people, was that there was some resistance, and they would think like, oh, what is this thing that just monks are doing, sitting there and breathing, and, I'm not a Buddhist, and that's not for me. So it's really important, I think, when you introduce it to people, to mention that this is not, you don't have to be a Buddhist, or you don't have to believe in some specific type of religion. Yes, it is true that those practices have been imported, from India and China, and they are connected with some of those ideas. But definitely there is nothing about religion, and I'm not a Buddhist, and I'm still practicing. So, and the other piece is that there are a lot of ways that you can practice, a lot of ways that you can meditate. But what I like, and why I signed up for mindfulness based cognitive therapy particularly, is that because it's a very clean sort of model. So again, it's not connected to any other type of meditations. It's just this simple, basic awareness. So definitely.
So I wonder if you could describe what you just referenced, right, in that mindfulness-based cognitive therapy. Could you give us a little bit of a description of what that is and where we might apply that for mental health and even potentially, individuals with substance use disorder?
Absolutely. I first want to mention, by the way, I'm Bulgarian, so that people are not spending a lot of energy wondering where this Eastern European accent is coming from. And I would like to say maybe a little bit of my story, how I ended up liking mindfulness, because it was really interesting. So I came in the United States in 2015. I just finished my PhD in sunny Switzerland. I was living in the Italian-speaking part of Switzerland. And then I decided, I had the opportunity to have a postdoctoral position at the University of Massachusetts Chan Medical School. And so I came here in 2015 during the winter. Now, I don't know where people are joining us from, but Massachusetts in January is crazily cold, like really crazy. And I happened to arrive during the winter where the snow was literally covering the whole house, and we weren't even able to go out from the door. And my boss at that time, he was very passionate about mindfulness. And he told me, Zlatina, here at UMass, we have the best center, one of the best centers for mindfulness, because the UMass Mindfulness Center was actually created by John Kabat-Zinn. And for those of you who haven't heard his name, this is the person who actually imported all these practices and translated them for the Western world. And so my boss was like, you have to sign up for this class, you have to try it. And back there, I didn't have any idea what is mindfulness. I was curious about it, but I was a little skeptical. I was one of those people who were thinking, well, how this kind of deep breathing is going to help people? What is this all about? But anyway, at the end of January, I signed up for the mindfulness-based stress reduction class here at UMass. And I have to tell you that as a clinical psychologist, with all the techniques and practices that we learn at school and we apply also now ourselves, mindfulness is being my probably most helpful intervention for myself. And I remember I signed up for this class, and it's an 8-week class. And so you are meeting with people, a group of people, every week for 2 hours. And the center is in this beautiful place surrounded by a lot of trees and in the middle of a park. And I really wanted to get it. And so every day when I would go back home, I would meditate for 45 minutes because those were the requirements, and I would do all the homeworks. And it really opened up a new world for me, because I think that you start to become aware of another way of being in yourself that we all have. So anyway, that really helped me to survive and to stay and survive the winter in Massachusetts. And then I really wanted to implement this model also with the people that I was working with, the patients. And so I was curious about different, models and applications. And then I get to know the mindfulness based cognitive therapy, which is basically very, very similar to the mindfulness based stress reduction model. It was created by these three people, Zindel Siegel, Mark Williams, and John Teasdale. And back in 2002, I believe. And the beauty of this particular version of mindfulness is that it incorporates elements of cognitive behavioral therapy and elements of mindfulness. And so it's interesting how this whole model was sort of created, because it was created for people with depression. And what these three people who created the model noticed was that, as we know, depression is one of the most common mental health diagnoses. But the problem with depression is that the relapse rates are still really high. So we have a lot of therapy for depression. We have pharmacotherapy, we have cognitive behavioral therapy. But the statistics were still showing that those people who had one episode of depression in their life, their likelihood of having another one was over 50%. And people who had more than 2 episodes of depression in their life, the likelihood of relapse was over 70%, which is really shocking if you think about it. And so they thought that mindfulness, and particularly mindfulness-based cognitive therapy, can help people to basically catch their thoughts, catch their mood swings on time, become aware of them, and not being basically, brought away from all these negative patterns of thinking and then find themselves into another depressive episode. And so it combines a lot of, as I said, a lot of elements of cognitive behavioral therapy. There are 8 sessions. And basically, the theoretical framework of mindfulness-based cognitive therapy is that people with some history of mood disorders are much more sensitive to even small changes in their mood, right? So even if let's say I wake up in the morning and if I feel a little bit more sad or a little bit more anxious, this can activate a whole bunch of negative patterns of thinking, right? I will start thinking, why do I feel in this way? Or, oh my gosh, my life is so bad, and so forth. And then those patterns of thinking can then activate another episode of depression. And then the risk of suicide and all this is increasing. So this is kind of the theoretical framework of the whole model. And again, the idea is to bring all these concepts of mindfulness and apply them in terms of awareness of your thoughts and emotions, right? So it's focused on the body, but particularly also with helping people to pay attention to thoughts and emotions.
That makes so much sense to me, right? I'm a cognitive behavioral therapist, right? So that's kind of my clinical background. And, you spend a lot of time in CBT helping people kind of recognize what their automatic thoughts are and what their thinking patterns are. But sometimes that's hard for people, right? To recognize what thoughts they're having, to kind of sit with that, to kind of see what that looks like. And it just makes so much sense to me that mindfulness kind of, keeping you in the present moment and just being aware of, how you're feeling, what your emotions are, and what your thoughts are can really support the implementation of CBT.
Yeah. And Lisa, it's really interesting because there was a research. Basically, these models started off from a very interesting paper written by Teasdale and some other authors. And what they were showing is that basically, as we know, cognitive behavioral therapy, one of the goals of cognitive behavioral therapy is to help people change their unhelpful or distorted beliefs, right? To change the way that they think. And so they did this research with these people who had history of depression and who completed cognitive behavioral therapy. And so they assumed that if people got better, if people got out of their depressive episode, that would mean that they also changed their beliefs and they changed their thoughts. But what they discovered was that basically people who recovered from depression and people who were never being depressed, their cognitions were pretty similar, right? And that actually those people who were depressed, they didn't change much their thoughts and their beliefs. But what they changed was actually the relationship with those thoughts and beliefs. They said that they had more skills to basically approach their thoughts and beliefs in a different way. And I think that this is the difference and the additional thing of mindfulness, that it doesn't really put that pressure on people, oh, you have to change the way that you think, or there is something wrong with the way that you think. But it helps people to almost normalize their thoughts and their feelings and to develop a bigger distance between myself and my thoughts and feelings. Because if you think about, that's the problem in a way, right? When I identify with my thoughts and I believe completely my thoughts, that's how I end up feeling more sad or depressed. But if I'm able to see my thoughts as mental events that are not necessarily true all the time, then there is more space. And so anyway, I thought that this was interesting how they researched that.
I find it fascinating that there's research on that. And as soon as we get off this podcast, I'm going to find that research, because for me personally, speaking from a place of lived experience and going to mutual aid meetings, I heard once something very similar from someone who I'm sure did not know about the research, but as far as the thoughts changing or the thoughts not changing, it's almost like the person has two factories in their mind. Right. And the one factory is just manufacturing lies and distorted thinking and really negative thoughts. And the other factory is believing it and buying it and saying, oh, yeah, that's true. That's true. And in recovery from substance abuse, or like you mentioned, depression, it's like there's the little quality control guy right in the middle deciding what to buy and what to throw away. So, the thoughts don't necessarily change, but it's what we do with them. And I know from my work here on an inpatient substance abuse setting with adults that I often find myself saying to clients that bring these worries to us, we don't get in trouble for our thoughts. We get in trouble for our actions. So how to stop the thought before it becomes an action.
Yeah.
There's so much there I could go on and on about. But one other thing I just wanted to mention, where you Lisa, I think you said it a while ago, mindfulness doesn't have to be tied to religion. And I'm so glad you said that, because that's a big pushback that I see here too. We do mindfulness groups here at an inpatient setting, and it's really hard to get 26 clients and a few staff to be quiet long enough to do mindfulness. And I found myself walking in not aware of what group it is. And, here I come making all the noise in the world, and everyone turns and looks at me, right? So to sort of roll with that and roll with, it's not going to be completely silent. You don't have to be like a monk on the top of a mountain, but to just have that connection with what's going on in your own body, your environment around you, your thoughts. That I find is the real key to my own personal mindfulness.
Absolutely. And I think it's worth it, Jesse. Thank you for mentioning that, particularly in residential, inpatient settings, but also really anywhere, to start groups and help people to provide some psychoeducation about mindfulness and the research behind it, because now there is so much research showing how mindfulness practices are changing specific regions of our brains, right? They're calming down the amygdala. They are reinforcing the prefrontal lobes and the executive functioning of people. And this is then connected with well-being and less stress and less anxiety. So I found it helpful when I did my groups with people with mindfulness to really provide this sort of research and explain that this is not something that, we just came up with, but it's actually something that makes a lot of sense.
I agree completely, Zlatina. And in real time, I just had this aha moment. If anyone was watching, it was kind of like, whoa, I don't know where everyone's listening or watching, or you'll hear this later. it is Monday morning right now, and forgive me for not mentioning this at the beginning. I believe that I've been in contact maybe with a colleague of yours. I'm in a master's program for counseling psych at a local university, and I remember a class last year with lots of research papers, reading lots of research papers. And the professor, Dr. Galvin, I think Dr. Paul Galvin, worked at UMass, and his whole research was around hope. So his theme of the research was finding hope in clinical settings. And it just reminded me of that when you said that, this lens that we look through, forgive me for not remembering the exact thing. It just kind of like got pushed out by the aha moment I had. But that whole semester, we were looking at all these research papers in a totally different way, because we were, looking at it through the lens of hope and mindfulness. And it was just a really interesting way of looking at research, something that was completely foreign to me before.
Absolutely. I think, Jesse, we should exchange a couple of papers after the podcast, because I'm curious about this thing too. And sorry, Lisa, go ahead.
Yeah, I was just going to say, whether we intend to or not, I don't think we've had very few episodes of Airing Addiction that have not talked about hope, right? Like that is probably the biggest theme that I think we have on this podcast, and hope for addiction recovery. And I do really see mindfulness practices as very closely linked to hope, right? Like it's a lot easier to see possible pathways, right, that include hope when you're using mindfulness practices and you're not being carried away by all of your negative thinking and all of your emotions. You're accepting them as they are, but can then see, the potential hope. And the other thing I wanted to comment on was the research you were talking about of the ways in which mindfulness actually changes the brain, right? It's actually changing the brain in the areas of the brain that are directly impacted, right, by addiction, right? So, of course, there's your reward pathways, and, that if it's impacting your amygdala, and, I always say, like, I'm like, not a doctor and or a scientist. So I'm like, the back part of your brain, the front part of your brain, I use like really simple language, right? But then there also is impacting kind of the front part of your brain and that decision making. And that's often when we refer to addiction as a chronic brain disease, it's because of the impacts on those parts of your brain. And so if there's something that can support developing new pathways, right, and supporting doing things differently than you've always done them, I can just see how applicable mindfulness can be to addiction and to substance use disorder.
Absolutely. Lisa, actually, now talking about that, I prepared a little poem, because mindfulness comes also with a lot of poetry. And what you are saying, I feel like it's exactly reflected of this poem. It's kind of a funny one. Can I read it? Really?
Yeah, please.
Okay. So it's called Autobiography in 5 Short Chapters by Porsche Nelson. So there are 5 chapters, right? So chapter number 1, I walk down the street. There is a deep hole in the sidewalk. I fall in. I'm lost. I'm helpless. It isn't my fault. It takes forever to find the way out. Chapter number 2, I walk down the same street. There is a deep hole in the sidewalk. I pretend I don't see it. I fall in again. I can't believe I'm in the same place. But it isn't my fault. It still takes a long time to get out. Chapter number 3, I walk down the same street. There is a deep hole in the sidewalk. I see it. I still fall in. It's a habit. My eyes are open. I know where I am. It is my fault. I get out immediately. Chapter number 4, I walk down the same street. There is a deep hole in the sidewalk. I walk around it. Chapter number 5, I walk down another street. It's kind of
perfect, right?
Right.
It's what we're talking about.
Exactly. It kind of describes this kind of our patterns of thinking that are so habitual, right? And we we live our lives in this automatic pilot and we're not even aware, whether it's, for addiction and when we have maybe a craving and then thoughts and then we get into some action and we're just so habituated of our usual way of thinking and doing. And what mindfulness does is that really creates that space. And as Jesse was saying, it creates those choice points. Right? So I'm aware of where I am. I accept it. I see it. But then that allows me next time maybe to have that better choice and maybe change if I want to. So I just thought it was a relevant way to think about it.
And that's exactly how I describe it. When I was part of creating that curriculum that Jesse was referencing, right, that we use across all of our programs, and also just a guide, for the use of mindfulness for, our various populations. And, creating that space is one of the ways that I always describe how helpful it can be. Right, is that creating that space between, kind of your thoughts and your actions. And if you have the opportunity to have that space in a non-judgmental space, right? I think that's the really important piece, right? To have not just space to see it and then be hard on yourself and let the shame and guilt come in, right? That is very common in addiction, right? But to create that space in a non-judgmental way and just see it for what it is.
Absolutely. Absolutely. And even if shame and guilt come, you can see them, you can recognize them, and then let them go. I think that that's also important to be, as you say, non-judgmental and allow things to come and go, because we know that there is no eternal feeling, there is no eternal thought. And I think that mindfulness, the hope that it gives is that allows people to see those patterns of thinking and realize that nothing is permanent, right? This idea of impermanency. And I totally agree with what you're saying, Liz, about this idea of not being judgmental. And there is a big piece also, there are a lot of implicit messages that comes with mindfulness, because the way that we guide mindfulness meditation is also using specific type of language, which is a very kind and gentle language. And I think that implicitly that helps people to be kind to themselves, right? So one of the things that we say when we guide the meditations is, at some point, as we are sitting here, you will have probably a lot of thoughts, and this is normal. This is what our minds do. So just try to notice these thoughts, and then gently, with a lot of kindness, invite your mind to come back to the breath and to come back to the body. And even if you have to come back 1,000 times, that's okay. That's the moment of mindfulness. And that's the other piece that I've noticed with people when I was teaching mindfulness, is that people have this belief that mindfulness is about sitting there and not having any thoughts and just being able to focus completely on your breath and your body. And for people who are not used to do that, it's frustrating because that doesn't happen simply, right? There's no human being who will be able just to have no thoughts, because we have brains, right? And this is what brains do. They produce thinking. And so what I always tell people is, mindfulness is not the absence of thoughts. Mindfulness is about being able to recognize that moment when your mind is taken away from these thoughts, recognizing this, and then with kindness, bring your mind back here. And so that's the moment of mindfulness. It's not the absence of thoughts, emotions, or distractions.
I'm glad you brought that up, Zlatina. Two things. One, I remember being at a recovery retreat, and we had a morning meditation to start the day, 6, 7 in the morning, what have you. And it was my job to prepare the coffee, because people getting up that early are going to need some caffeine stimulation usually. So we got one of these big 55 cup, huge percolators, metal, old school things, make a ton of noise. And I woke up, I set an alarm, I woke up early, I put it all together and hit the on button, and then you got to wait for the thing to warm up. So I do that while they're getting ready for the meditation, and I join in on the meditation. And the meditation guide was a friend of mine who is very deeply just entrenched in meditation and yoga and mindfulness. And as she's doing this guided meditation, all I can hear is this coffee pot that I set in the same room. And it is just, it might as well have been like an air horn to me. And I'm freaking out in my head. I'm like, I can't meditate. I screwed this up for everybody else here. No one else can meditate. And then Kelly was her name. Kelly actually incorporated the sound of the coffee pot into the guided meditation. And once she did that, it was like, I could meditate again. I didn't worry about anyone, right? So to your point of, it's not the absence of thoughts. I've read somewhere in a study, I think, the average is like 60,000 thoughts a day that we have, most that are unconscious. And I think it was 60,000. And, I was the exact same way when I started to meditate, especially in early recovery. I have all these thoughts going around my head. I have this preconceived notion that meditation means the complete absence of thought, and I'm supposed to just sit there blankly. And I couldn't do it. So like my meditation practice looks like guided meditations, where they say the exact statements that you said. If a thought comes in, acknowledge it, and then just watch it go out. I meditated before this podcast right here. And it was a simple little, I knew I needed to get centered and focused. This, again, Monday morning, this is the first thing on a Monday. Maybe at least we should do some more Monday morning podcasts. This feels good. It's like after the weekend, maybe we're like a little more recharged or something. But I knew I needed to be like in work mode from home mode and just get centered. So a quick little, mindfulness meditation, guided, and then boom, hopping on here. I'm sure I had plenty of thoughts during the meditation, but I don't remember them now. I just remember the feeling that I got of relaxation and focus from that meditation practice.
Absolutely. And I'm glad that you mentioned that example with the coffee machine, because this is exactly what is happening most of the times. I remember I was leading this group in an outpatient setting with adults. And the room next to us, basically, they were workers who were like drilling in the holes and like making all these things. And we were supposed to do a sitting meditation. And so at the end of the meditation, one of the people were so frustrated. She was like, I couldn't focus. Why these people are here? That's unbelievable. But the idea is, yes, to incorporate even that, everything that is happening around you and being aware of that, because this is also life, right? Nothing is going to be perfect. We will always have something that will come out from the external world that could be distracting or annoying. And usually the way that we react to unpleasant things is by wanting to push them away. I don't like that, right? And why these people are working, and that's so annoying, or whatever. But if we can actually stay with the reality of what is happening, even if it's annoyance, right? Or even if it's something that was completely unexpected, and if we can, again, develop that anchored place within us that we can just see things for what they are, actually our suffering will be less, and we can see things more clearly and stay with them with what they are. Because that's also another theory that it's kind of coming from meditation, that basically says that pain is universal, right? So we all experience pain, all human beings. But suffering is something else. Suffering is actually something that we are adding on our pain, right? So if I have a headache, and if I start ruminating about my own headache, oh my gosh, now I am not going to be able to work. This is horrible. Here you go again. I am adding on my actual pain a lot more of suffering, right? And so mindfulness helps you to just stay even with the unpleasant and be aware of it without having all these additional judgments and interpretations that makes it much harder.
Yeah, and I would really echo some of like that ability to stay with what is wherever you are, right? So I also took the mindfulness-based stress reduction course, but I took it at the height of COVID, which meant I took it completely virtually, right? Still, so it didn't have like the lovely trees, didn't get to go to like UMass or to, to Assumption and do like a nice space, right? That was set up for this purpose. I had to do it in my own house with my family and noise and all the things that exist in my house, right? And I still really feel like I had the benefits, including the all-day retreat, right? And we talked about this a little before the podcast, Zlatina, that I was able to do an all-day retreat in my own space, right? And so one of the things that I really love about mindfulness and us integrating this into treatment, both for mental health and for substance use disorder, is that it is something that individuals can take with them wherever they go, right? It doesn't require, any equipment. It does not require, you to have an expert next to you, right? There's tons of apps you can use if that's supportive to you, like Jesse was describing, or you can just, mindfully take a sip of your coffee, right? You can mindfully, either meditate or go take a mindful walk, right? Like it's free, really. And so it doesn't matter kind of what your circumstances are. It's not something only for people who can access it, right? We can all kind of access that.
Absolutely. Absolutely. In whatever we are doing. And I think particularly also when we talk about people with mental health conditions or, substance use disorder, I think that's really important, not to force people to do it in a certain way, but as you're saying, to be very flexible and be like, yes, you can, do mindfulness while you're playing your guitar, for example, or listening to music. And this was exactly what I was doing with my groups, with young adults and children and adults. Let's say if there was someone in the hospital who was really talented in playing a guitar, I would actually invite this person to bring the guitar and we will have a mindfulness meditation, just listening to the music. Or if there was a talented person in singing, I would invite them to sing, and then we would listen to them. I actually did a research. I'll very briefly mention this because I think it's related to what we're talking about. I did a research in the same psychiatric hospital about how can mindfulness help people with mental health conditions. And of course, we had a lot of people with substance use disorder there. And you know how there is this myth that people with trauma, particularly mindfulness, can be, not good for them or whatever. But what we all actually saw was that from all the people we basically wanted to see if there was a mental health condition that was particularly sort of benefiting from our groups in mindfulness. And what we discovered was that actually people who were diagnosed with PTSD and substance use disorder were those whose mindfulness skills improved the most after the groups of mindfulness. So actually, those were the people that for some reason got most out of it. And so I thought that this was really interesting. And the other thing that we saw was that the levels of anxiety from everything else going around was something that significantly reduced after the groups that we were doing. And the other piece that I feel like we should think about is to also be careful, particularly when we work with people who might have still some acute symptoms or, some mental health conditions. We need to modify mindfulness. We cannot expect, from these people to sit down for 45 minutes and focus on the breath, because a lot of times the body is an unsafe place, right? And in a way, mindfulness is about helping people to bring their attention inwards. And so what I think it's really important for this type of population and settings is to start with giving, first of all, a lot of options to people. So really, I would always say it's completely your choice if you want to close your eyes or if you want to keep your eyes open. And I remember I had this woman who, during one of my classes, she was like, I cannot keep my eyes closed, because she had a significant history of trauma. She was saying, what if something bad happened, in this room? Or so for her, it was really difficult to let her guard down, which is completely fine, right? And so giving a lot of options, if you want to open your eyes or keep them closed, if you want to sit, if you want to lay down, allowing people to take a time out if they need to, if they feel particularly triggered. And the other thing is incorporating more sensory motor type of exercises, exactly what you were saying, Lisa. Not just doing breathing or body scan, but maybe mindful eating. I would bring some candies in the hospital, and I would ask people to close their eyes, and I'll put the candy on the palm of their hand, and I will ask them, to feel it, to hear it, to smell it, and then to guess what's the shape. And then if they feel comfortable, eat it. Or listening to the music. So just sort of incorporating more sensory motor things and making them shorter.
And giving those options, I think, is really important, right? So in like our guides that we use for our staff, we've got some groups, right? But we also have a ton of activities and even tracking sheets, right? So as part of your, homework from session or from group that day in an inpatient unit, you can try some things out yourself and see what seems to fit for you, right? Because it's a very individual experience, kind of what you get from mindfulness. And it's not a one size fits all. Like everybody should do this meditation or this approach, right? It really is about what seems to be supportive for that person.
And I completely agree, from obviously what we're talking about here and the clinical research and the proof to back it up, but my own experience. So my own experience was when I was a client here on this campus, I was in an old house with way too many people. I loved it, but there were, I think, 60 something clients in this house, and mindfulness was just not something we thought of. I mean, everywhere we went, in our rooms, we would have bunk beds. So there was 5 people in my room when I first got here. And, in every group room, there's always someone doing something. So what I found is at night, I would go outside. We were allowed to just like walk the perimeter of the house, and the stars was what did it for me. So I grew up in a city where just the light pollution it wasn't conducive to looking up at the sky and seeing much. And I came out here, which wasn't too far away, but far enough where, I could just look up and see the stars. And that's what did it for me. That was my grounding. That was my first sort of introduction to mindfulness. And it was totally out of necessity. It was just out of, what can I do to get away from people just for a minute? It wasn't isolation. It was just, I need me time. I can't find it in here. Oh, here we are. And then I'm, just looking up at the stars and I still do that today. Only difference is I don't do it in that exact location, but it's something that's, been a learned practice and that I've built off of, both out of necessity and out of curiosity. Zlatina, you mentioned the candy. One of our lead clinicians here, Kirka, she did the same thing in a group with Hershey chocolate kisses. I don't know about you both, Lisa and Zlatina, but when I eat Hershey chocolate kisses, I eat them by the bag. And I'm not really mindful of, I just want to unwrap it as quick as possible and boop, and then the next one. But, the whole group was eating a chocolate kiss mindfully. Yeah. And it was just so amazing to, take that pause and that curiosity of, what's the texture? What's this feel like? What's this taste like? What's this smell? Exactly what you did, Zlatina. So, I felt it was beneficial to mention that. If anyone's listening here and they're like, this sounds great, mindfulness, that's an awesome thing that those people do, but I can't do it because of X, Y, and Z. You can just modify it. Whatever someone's eating breakfast right now, you can eat it a little more mindfully and start.
Can you talk a little bit about, what you're really saying was helpful for you, Jesse, was really an act of self-care, right, while you were in residential. But I also think an important part of this is encouraging our practitioners, our counselors, our clinicians, our providers to also practice mindfulness. Zlatina, can we talk a little bit about why that is beneficial?
Absolutely. Well, it is super beneficial because I think that, first of all, if we want to teach people mindfulness, self-care, or whatever we want to teach them, we are the first people that need to practice that. And particularly with mindfulness, because it is something so if you talk about mindfulness, it can sound a little bit abstract, right? And it's not until people actually try it that they understand what we are talking about. And I think that if you, as a clinician, if you don't embody the mindfulness itself, it can sound really phony to people. But the other piece is that there is also a lot of burnout in clinicians, a lot of stress. And I think that mindfulness can really help also people working in residential settings, so in whatever other context they are working with people, to sort of be aware of their own emotions and regulate themselves. And so that we can present ourselves to our clients again from that space of being anchored. And that doesn't mean that our thoughts and emotions will disappear and we will not feel any stress, but it means that we are walking in those rooms embodying that sense of awareness and presence, which I think automatically reflects on the people that we work with.
Yeah, it's proof positive. It's an example that this thing really works. Right. If I take care of myself, over the weekend and come back Monday morning, recharged and ready to go, that's noticeable. If I just had a blur time off where I was go, 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 go and burnt out more, that's also noticeable.
Yeah. And I wonder if that's a good tie-in to talk a little bit about some of the work that Spectrum's done with UMass on supporting parents with substance use disorder and those that care for children. So we, Jesse referenced in our Magnolia Family Support Group meetings before we started the podcast today, we also end with a self-care activity, which is quite often, because it's really accessible on Zoom, as I've already mentioned, right? A mindfulness meditation as an option for folks. But I know that you've also done some work with foster parents and other groups to kind of integrate mindfulness into work that you do. Can you talk a little bit about that?
Absolutely. So first of all, parenting, I think, could be one of the most stressful things. And so being already a parent means a lot of stress on people. And yes, we do a lot of work with foster parents, and we are implementing one curriculum that is called the Resource Parents Curriculum, where we're basically helping foster parents to understand the children that are coming in their care and give them some tools to, manage the behaviors and emotions. And it's interesting because the original curriculum incorporates self-care in the last module, which is module number 8. But what we started doing, because we started doing these groups during COVID when people were really stressed out, and what we started doing with my co-facilitator is to actually start every session with a small mindfulness practice, even if it's 3 or 4 minutes, just to sort of help people arrive in the virtual room and help them to sort of transition from the hectic day or morning that they have been having into, being here and sending this intention of being present. And we framed this as self-care. We were saying, we would tell people, we want to really practice what we are teaching. And so this is a little example of a self-care, how you can take some time from your day and just, be aware. Where are my levels of stress right now? Where is my breath? Where are my thoughts? And what do I need right now? So we found that it very, very appreciated. At the beginning, I wasn't very sure how people will receive this, every session. But we found that people really, really liked it.
Zlatina, that reminded me of something you said on the last podcast that I went back and listened to. And for anyone that's listening now or watching, I highly recommend to do that. It's more of a trauma-focused podcast, but you said that the child's brain, now we know grows and changes until age 26. And I believe you said, and correct if I'm wrong, the number one predictor of outcomes is a steady, like an anchored parent in a child's life.
Yeah, this is such a great connection, Jesse. Thank you so much. Absolutely. Yeah. So we know that the number one factor for healing children from trauma, but also for helping them to grow healthy, is the presence of even one safe, predictable, and nurturing caregiver. And again, if you don't have that parent that it's anchored and that takes care of themselves and it's aware, it will be really difficult to regulate the child or to give the care, right, that you want to give. And so mindfulness can be definitely one way, again, for the parents to find that anchor in themselves and then to have the choice how they want to present themselves with the kid and take a better care of them.
And especially if you think of that, parents with substance use disorder, parents in recovery, right? Right. So, not only do they have the stress of being a parent, because we've talked about that's stressful enough. The world is stressful right now. It's been a very challenging couple of years, but then you layer in the history of substance use disorder, maybe additionally some mental health symptoms, right? And so this is a practice that can really support the parent taking care of themselves so that they can also do what we know that they want to do and take care of their children too in their recovery.
Definitely. And particularly for parents with substance use disorder, we know that exactly those brain networks that are about attunement, that are about reading the cues of the child and responding in certain way, are impacted by substance use, right? And so I think that mindfulness can be a little bit of a buffer that also, helps those brain networks to be rewired. And help these parents to focus on the child and discover that play and curiosity within themselves.
I think that could be a whole nother podcast episode. So you know what, we could actually do that, and I think we should with you and or your team, Zlatina, to talk a little bit about the fantastic work that's being done in that space, because I've been really impressed by it, and it's really supported my practice as well. So that's just fantastic tie-ins. And so we're kind of already at 50 minutes. We could probably talk all day. I think we just cover this whenever we talk. Right, that we could just
have a whole page of notes already. I have papers to look up, and I'm sure we'll exchange some. So yeah, this has been great. Thank you so much for sharing your experience. And just as a teaser for the next podcast, whenever that may be, I would be very interested in your work with families. As my role here is with families in an inpatient setting, and just to tie in the self-care piece, whether the parent is in recovery themselves, which that happens often, or it's the parent of the clients here, and they want to include their parents in their treatment here. And I reach out every single time I ask about self-care, and not every single time do I get a overwhelmingly positive response. Because these people are in crisis mode, and it takes every ounce of motivation in them just to continue doing what they're doing right now, sort of just propping up the loved one in active addiction or recovery. And, I bring that to their attention that, we can't give out of an empty cup. We need to, like you said, Zlatina, need to be anchored and then turn around. It's like the air mask on the plane, right? They say turbulence, put yours on first. Right. I told that to two people last week, and both of them got it wrong. It said, no, you help the other person first. And I said, right there, that's your thinking that is, you believe that, but in actuality, it's help you first so you can then help others. So.
Absolutely. Yeah. I would love to come back and talk more about that. So it's always great to be here and work with you guys. Such a great energy.
Thanks so much. And so, like we often will do at this podcast, is there a resource, a book, another podcast, anything that you would point our listeners to in this area?
Yeah, just very quickly. And actually, I will point out something that Lisa introduced to me because I'm using a lot of apps and, I have read some articles and books. But the app that really got my attention and that I'm using a lot is called 10% Happier. I am not sure if it's free for everyone. I was really lucky to sign up for free access as a mental health clinician. But this one is really great. And they also have a podcast, actually, which is amazing because it's Dan Harris, who is a journalist, a famous one. And he has a great way, like a really funny way to talk about mindfulness that it's really easy to understand. And the people behind the scenes who are working with him are actually some of the biggest experts in mindfulness. And so you can find a lot of interesting talks on the podcast. And for those of you who want to download the app, there are a lot of interesting meditations. And I'm not paid by them, by the way, to advertise that, but it's been a really, really helpful one.
Yeah. And I believe, don't quote me, and it depends on when you're listening to this, but because May is Mental Health Awareness Month, to bring us right back to the very beginning of this podcast, I think they are again offering free access to mental health professionals. And so check that out on their website. The podcasts are free, right? So that's pretty cool. Right. And I think some basic pieces of their app might be accessible for free, just maybe not the full access, which is pretty common. But there's lots of other options too. Insight Timer is a great free app that has a ton of resources, but I would agree with you. I enjoyed that app and podcast too.
Well, I just downloaded the 10% Happier podcast, and I know what I'll be listening to on the way home from work. Thank you.
All right. Thank you all so much. Thanks so much for joining us again. And we will do this again soon to talk more. Thanks everybody for listening. Like, subscribe, do all of the things, and have a great rest of your Monday.
Take care.
Have a great day, everyone. Thank you. Bye.